we look to provide you with up-to-date medical procedures through our series Ask a Pro. And this week we're sitting with Fred Harrington, Assistant Professor of Neurosurgery. Hello, thank you so much for joining us.
Morning.
So what is minimally invasive spine surgery?
Well, minimally invasive spine surgery is probably best described as surgery without a very big incision, a small incision. So surgery done to be less painful and yet equally effective as it used to be, or as it still is.
Okay, so less painful, so I'm assuming more people are going this route, right?
Well, it's being offered more and more.
Okay.
It does require special training and special expertise.
Okay, so what was offered before this was kind of discovered? You said now it's kind of taking off a little bit more. What was there before that?
Well, I think people are probably familiar with incisions in the back that, you know, were a few inches long or more.
Looked like a caterpillar.
Yeah. that kind of surgery. Whereas now the incisions are much smaller,
Okay.
and the amount of muscular tissue movement is much less to get to the spine.
Okay, so why would somebody need to get this sort of surgery?
There's a lot of reasons. Usually it's because of pain. It's because of back pain of some kind.
Oh, okay.
And there are different kinds of back pain. Some are better treated with surgery than others.
Okay, are there any signs that people should look out for?
Sure, leg pain,
Okay.
buttock and leg pain is a big one. Numbness in the legs with standing and walking, pain in the legs with standing and walking.
Oh, okay.
Those are the main things.
All right, so is all minimally invasive spine surgery, is it all the same, or are there different kinds?
Well, actually, it's getting more minimally invasive, and now we're offering at UNM endoscopic minimally
okay.
invasive
So what
spine
is that?
surgery. So endoscopic spine surgery is really surgery through a very small tube where there's a camera and where the surgeon can also do the surgery. So I've got a pen in my pocket,
Okay.
and the tube that we use is really no different in size than this. It's about 7 millimeters
Oh,
or 8
okay.
millimeters in size. And so we can do the surgery through that kind of a small access tube.
Okay, so is it harder or is it easier?
It requires some training.
Yeah,
It
definitely.
requires expertise on my part and the other doctors that perform it. But the real benefit is for the patient. You know, we're learning this and we're doing this because patients can go home the same day. They don't go
okay,
home.
so they don't even have to stay at the hospital
They
overnight.
don't have to.
Wow.
Usually when it's done this way, you don't have to stay in the hospital. You're going to go right home because you don't have the discomforts and the other things that go along with more extensive incisions.
Okay, so what is the recovery time? So they are able to go home that day, but how long is it before they can, resume their regular activities?
It varies, but it can be very, very soon. It can be within a matter of days.
Oh, really? So now before they were doing minimally invasive spine surgery, did it take a lot longer to kind of come back?
Generally speaking, it did take a lot longer. So we went from open procedures to minimally invasive procedures through tubes that were a couple inches wide, and now we're down to this.
Okay, so I mean, it's great that this is happening now, but I would rather not have to have surgery. Do you have any tips for people like me who, can prevent having to have this surgery?
Absolutely. The most important thing to keep healthy with your spine is to stay in shape, to exercise, to keep your weight under some kind of nice place.
Okay.
And really that's the way. A healthy lifestyle goes a long way to avoiding having problems with your back.
Awesome. Thank you so much. Really, thank you for coming in. That's great advice. And it's good to know that if something does happen, there is an option that's not as painful and you can jump back within a few days.
And one of the other things that we offer at the UNM Center for Spine Health is non-surgical treatment. Treatment so that people, if they come in and they have a back pain problem, they don't need to feel
better.
like... Exactly. In fact, most people that we treat
Yeah.
don't undergo surgery, even minimally invasive spine surgery. So our goal really is prevention, and then surgery is only a last resort.
That's great. All right, well, thank you so much for coming in. So if you want any more information on the spine surgery or lack of spine surgery, just head to CASA.com and click on the Style tab.